Okay, so good morning. And again, thank you very much for inviting me to come and talk to you today in relation to the Play Standard tool. It's important, I suppose, given the work that it's being involved with and the very wide and varied way it's being used since its inception in 2015, that maybe we should have the opportunity to consider where it came from and consider the evidence base that stands behind it. Because I think if you appreciate that, then for all the simplicity of this device, the complexity of its actual actions and reaction within communities, I think is quite incredible. So again, this is as you say, this is a festival. So I'm sure you've all bought tickets for today and tomorrow. So today's session with me will really be about what stands behind the Play Standard tool. And my colleague Kat, she'll be having a conversation with you tomorrow, which will be more about the actual development of the child and young person's Play Standard tool and the changes that were made to ensure that that was as engaging a process as possible for those individuals. Good, on to the next slide then. So, you try. Good. So thank you very much, Julie. So again, we need to recognize that we're talking about this from a public health perspective. And again, the Faculty of Public Health defines public health as a science and art of promoting health and well-being, preventing ill health and prolonging life through the organized efforts of society. Now, obviously, given the last year that we've all endured, we all acknowledge the incredible work of the scientific community in bringing us a vaccine for COVID. And we could never have dreamt in a year ago that we'd have a vaccine. So the science in relation to public health has served us extremely well. With regards to the art of public health, it's probably more about where we sit now if we're discussing the Play Standard tool, because it's about transferring that science into a conversation that we can all join in with. And I think that has been proved time and time again over the last year, when we've had difficult decisions to make with regards to being locked down and restrictions on our own freedoms that we all routinely enjoy. But again, the packaging of that message and the way it was delivered to us enabled us all to understand the importance of what we were being asked to do, and therefore we were more likely to take advantage of that advice. So again, when it comes to science and art, they are hand in hand. And again, the other key word there is society. We are all part of society, and certainly myself, Public Health Scotland, and the organisation I've worked for, my day-to-day job is about this definition and sustaining it and developing it. But ultimately, I'm just a very, very small cog in a huge wheel of which we're all a part. We are all part of society and we all benefit together. And therefore, again, the Play Standard tool is an opportunity to engage a wider society in the conversation around where you live, how you live, and what you've got disposable to you within that environment. So that's the public health context. I'd like to consider two models of healthcare: the biomedical and the ecological model of healthcare. The biomedical healthcare is scientific measure of health and regards disease in the human body having a breakdown due to a biological reason. A patient is seen as the body being sick and has to be handled, explored, treated independently from their mind and other external considerations. I won't go on with this, but obviously it really is about the hospitalization, the medicalization. And again, if we look at the last 12 months, where would we be without it? It's served us so well. However, what stands beside that is an ecological model of healthcare. And the core concept of the ecological model of is that behavior has multiple levels of influence, often including biological, psychological, social, cultural, organizational, community, physical environment, and policy. So the combination of the environmental, the policy, the social, and individual intervention strategies is credited, for example, with the major reductions in tobacco use. So it's just to highlight that any of us that are old enough to remember being able to smoke on an aircraft, and basically routinely in cinemas and bars and such like. When you think about the world we live in now, that change has been brought about using a variety of levers, obviously. The stick and the carrot. Obviously, you increase the price of the product, in this case, tobacco, and you also get busy educating the population in the devastating effects that smoking has on the individual and the wider community through passive smoking, for example. So that process has been ongoing, and it's led to, you know, an amazing result, really. And again, I'm old enough to remember being able to smoke in an airplane, but I never did smoke in an airplane. Just highlight that. Okay, next one. So if we look at influences that impact on people's health, there are 5 domains: genetics, social circumstances, environmental exposures, behavioral patterns, and healthcare. Now, obviously, they're all in play for all of us from the moment we are born. In fact, prior to being born, in effect, from the moment of conception, the genetics is involved in this process. So I guess, yeah, it's fair to say before we're even born, these things start to play out within our lives. And they all have a part to play in our present, past, and future. And it's important to consider that. So if you'd like to consider this diagram here, and again, it's a pie chart, and it's divided up into various sections: 40%, 30%, 15, 10, and 5. And ultimately, if I ask you, where would you place on that pie chart in relation to those percentages, healthcare and genetics? I'll give you 10 seconds to think about this and just think where you would place healthcare and genetics on that pie chart, against which percentage. Have you done it? Good, 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 good. Well, this is the reality. There is, again, let me apologize initially that this is a USA study, but I like the pie chart. And it's fair to say over the last 50 years, I guess we've mirrored the United States in relation to our development, our diets, our way of moving around, etc., our lifestyles. So again, I think it represents not too different a picture from our own experience here in Scotland. But ultimately, as you can see, genetics plays a significant role, 30%, but 60%, if you add together the behavioral, the social, and the environmental experience of individuals, it makes up 60% of the health outcomes. So as you can see, there's a huge conversation to be had around where we live, how we live, and indeed how we shape that environment to ensure that it benefits us and the community in which we live and the environment in which we live, because we now surely have to have a conversation about the wider climate and the impact that we're having on it. So again, it's hugely important to recognize that. So again, there was a phrase somewhere once used, show me the boy and I'll show you the man. It should really be, show me the boy, show me where he lives, and I'll show you the man. Because ultimately it's so determined upon your childhood and those lived experiences. Good. And again, if we consider this from the perspective of the last 12 months, as you can see this graph here, and it denotes the number of ethnic minority individuals that have died as a result of COVID over the last period, from May 2020 as a result of COVID. And that's against every individual white person that's died. So it's a very stark graph. And if you consider for a second the individuals that stand behind this graph, I'm sure you'll agree the significance of it. But ultimately, if you happen to be Black, Bangladeshi, Pakistani, or Indian and living in the UK for the last 12 months, if you're a black male, for example, 4.2 black males were dying for every white person who died. 4.3 black females were dying for every white individual that were dying. So you can understand this graph. And ultimately, what we need to recognize is that genetics does not play a part in this. Not totally, I mean, maybe marginally, but ultimately, it's not about genetics that this graph is so stark. And again, I think we have to acknowledge this in a conversation around the communities that exist and live in this sceptred isle, and understand a little bit more about equality and equity and how we treat others and how others treat us. So again, I think it's a stark reminder of the inequality that exists in our country. So enough about what makes us poor and sad and bad and ill. Let's talk about what makes us well. So pathogenesis is the biomedical prospect. And again, if you consider COVID, the stages of a pathogenesis: to cause disease, a pathogen must successfully achieve 4 stages: exposure, contact to the individual; adhesion, colonization; invasion, and infection. And in many cases, cycle is completed when the pathogen exits the host and transmits to a new host. Now, given what we've experienced for the last 12 months, I do not need to explain any further this process, that's for sure. Now, alongside this is salutogenesis. And that definition of this is an approach to human health that examines the factors contributing to the promotion and maintenance of physical and mental well-being rather than disease, with particular emphasis on coping mechanisms of individuals which help preserve health despite stressful conditions. And so again, it's very much about that. If we all, some people live in very difficult circumstances, and that's been borne out over the last 12 months with regards to certain communities that have suffered very badly in relation to this pandemic. And again, it really is about what the individual has and the community in which they live to sustain themselves and manage difficult circumstances. And ultimately, the numbers beg to differ, really, that we in this country aren't doing very well at that. There isn't the equity that there should be. Otherwise, there wouldn't be the disparity that exists within our society. So again, this is all standing behind the place standard tool, and the ecological aspect of this is really where I'm going. So the place standard tool, well, not the place standard tool, the place standard. It was developed in 2015, and it's the development process that took place to take all the evidence that I've just shared with you and place it in a format that's eligible and engage individuals at the community level, because it's hugely important that people we talk to are people who are living the life that they're currently existing in, and they're the best ones to tell you what needs to change to improve that environment. So that this is the physical representation of the research and knowledge that was gathered that I've just briefly highlighted. And so this is really just the outcome from that. And again, it's to support the delivery of high quality places in Scotland and to maximize the potential of the physical and social environment in supporting health, well-being, and a high quality of life. And that's what we're striving for here. We're striving for that everyone in Scotland should thrive. And there's work to be done, obviously, but we're hopefully moving in the right direction. So if we talk about place, what is it? It's an environment in which we live. And that can be the room in which you're sat now, the neighborhood in which you live, the country in which you live, or indeed the globe in which we all, planet in which we all exist on. Again, the people that inhabit those spaces, who are they? Where are they? and how are they feeling about themselves? How are they being supported? Placemaking really is about development of making places, and we do that, and we've been doing that since people painted drawings on caves many years ago. We're all manipulating our environment to make it more appropriate for ourselves, and we've now got to a point where we've got double glazing and central heating. Fantastic. But ultimately, the question we need to ask ourselves is, the places that we develop, do they contribute positively to us as individuals and the community in which we live? Do they have no impact whatsoever, so they're passive? Or indeed, are they have a negative impact on ourselves, our lives, and our communities? And these are the core questions that the Place Standard and the Place Standard tool asks of communities when they undergo this process of this conversation. Again, it's pretty straightforward. Again, it's a very simple tool, and the simplicity of it is a testament to the people who actually put this together in 2015, that they had such complex concepts and managed to develop something that was available and appropriate to anybody who chooses to use it. Again, it asks 14 questions of us. And again, it takes a holistic approach to the community in which you live. I know it's very easy. I've certainly been in conversations where you get a dominant voice or a dominant topic that might be interesting everybody in the room, and in doing so they neglect other areas of that community, other areas of interest. This 14 questions that are asked throughout this process ensures that the entire gambit is considered through this process, which makes it special. And again, so these are the 14 questions. And again, through that community engagement, data is produced and actions can be taken as a result of that. And the clever part is that because of the dialogue, the evidence you capture through that dialogue is absolutely invaluable in telling us what's going on beneath the numbers, beneath the statistics, which is really invaluable. Again, the Place Standard tool has not stood still since 2015. We now have, obviously, what we'll be discussing tomorrow and throughout maybe some of today as well, is the Place Standard children and young persons version. We all also now have a design version, which speaks to architects, if you will, and planners. International developments, the tool has now been translated into 16 different languages. So again, it's being used across the globe. Our Place website is a website that's being developed currently, and we hope to launch it very soon. And that's in conjunction with the Scottish Government. And that will be the go-to website for all things Place. We've got a Place Standard learning resource, which basically is an online option for people to go along and complete several modules of learning to enable them to better be able to carry out this process. Place Standard with a climate lens. I'm currently involved in that. Obviously, we're all talking about climate now. When we had the review of the Place Standard tool, and we went to V2, which is going to be launched quite soon, there was a conversation about making a specific section for climate. But what we discussed was, and what was finally decided, climate is so important that it has to be placed over the entire conversation. And therefore, we're developing a climate lens now, so you can address climate through all of those various segments. And we're also going to put the Place Standard tool online once we launch V2. So it's, again, people can engage with it via computers and via the internet, etc., which again makes it more accessible and more available to different people. Okay, I think, and obviously tomorrow, this is what we'll be discussing more and more about the children's and young people's Place Standard tool and the changes that have been made to ensure that it engages with these age groups and these profiles in as positive a way as possible. Good.